Patricia Foster, emerita professor of biology at Indiana University. It's a surprise because there hasn't been a naturally occurring case of polio in the U.S. in over 40 years. All the cases that have happened have been people who have come from another country. In this case, this was community spread. This young man got it. He hadn't been out of the country, so he got it from somebody else in the country. It no doubt came from overseas, but not to him. He got it from someone else. And the fact that they're finding the virus in the sewage means that it is actually spreading in the community. The other thing about it is that paralytic polio is less than 1% of the cases, so that means that out there in the community there are, many more, at least 100 more people who are carrying the virus. They'll be watching just for the community spread. They're monitoring the sewage to see, trying to get an idea of how widespread it is, what areas of New York it may have spread to. And it's frightening because it's a really terrible disease. When I was a child, kids that I played with died. They would get lifetime paralysis, adults as well. So it is an incredibly frightening disease, and there's no cure. The only way to stop it is vaccination. What experts are doing is they're telling people to get vaccinated. There's no cure for polio. The only way to stop spread is for people to be vaccinated. One of the reasons it's spreading right now is that the vaccination level in that area of New York is quite low. They estimate it's about 65% when it should be at least 95%. That's probably a result of the COVID pandemic where people just didn't bother to get their children vaccinated. But they should be, and it's very important. And adults, if adults can't remember if they were vaccinated or not, they can get a booster shot. In this country, we use a shot, an injected vaccine that consists of dead virus. And it's very effective in preventing paralytic polio. It's not that effective in preventing spread. There's a more effective vaccine we don't use, and that's the live virus vaccine. And the viruses in there are they're called attenuated, which means they're weakened, so they're no longer infectious. And that gives very high levels of immunity and prevents spread. It has a downside, though, is that those viruses can actually become, at a very, very low frequency, become virulent again. And that's what's spreading right now in New York, is a form of one of the strains of viruses that has reacquired the ability to cause paralytic polio. The other thing that experts are doing is they're re-educating doctors on what the symptoms are, because most doctors today will have never seen a case of polio. So they have to be aware that there's the less severe forms are more like a flu. And so if that's happening, those people, or babies or children, should be isolated to prevent spread.